Okay, cool. So thank you both for taking the time to have a little chat with me on my Let's Talk About Tech mini video series. So Lianne, I think we've known each other virtually for a little while now. You're obviously really active in the Leeds tech scene, and you're on the board for Women in Leeds Digital as well, I believe. Yeah. Which we've obviously got really good links with as well. So, and Erika, we've spoken before as well, separately to Lianne, because I know you were super keen at wanting to get in the health tech arena. We had a good chat about how you could start looking at making that happen. And then lo and behold, when I approached Lianne about Liria Digital, it turns out that you guys have done this together, which is fantastic. So I think the reason for me doing this is, like I said, just want to raise some awareness and give some kind of kudos to companies in the tech for good space, which is very much where it sounds like Liria Digital sits. So yeah, I'd just be really keen to kind of give the listeners a little bit more insight into what you guys are up to. So I guess for people, well, I think a lot of people watching this will know who you guys are perhaps, but for those who don't, it'd be really great if you could just give a quick introduction to yourself and maybe just a little bit about your background as well would be great.
Yeah, no worries. So hi, I'm Lianne. I am the CEO of Liria Digital Health. I haven't always been in tech. I was drawn to this industry a little over 3 years ago. I was coordinating a project for a charity, and the brief was solve destitution in Leeds. So it was this huge brief. And what I found when I set up this brief was one of the main barriers that people were facing in Leeds was their inability to access digital services. So things like the benefits system, housing, education, and that was really stopping them from being able to get out of their situation. So I thought, well, this is crazy in this day and age, how can we be moving towards a digital, everything digital first? And the people who need it the most can't access these services and they're falling through the cracks. So I got really interested in what is known as the digital divide, and it's a theory that suggests if you don't have access to digital services, you are socially disadvantaged in some way. So I started to research that topic while I was working at this charity during a master's for an anthropology master's. So still not tech, but still very sort of tech focused. And I started thinking, well, I'm really interested in this idea of tech for good. So how can I start thinking about a career that involves tech for good? And as kind of serendipitously, what happened was I got made redundant from that role due to funding cuts, as is the way with the third sector. And I thought, okay, so I want to get into tech. How do I do it? So the logical reason for me was, I'll teach myself all technical skills. So this is me coming from a completely non-technical background thinking, okay, the only way I can get into tech is to teach myself a technical skill. So that's what I did. In hindsight, I know now that's not the only way to get into tech, but at the time I thought that seems like a good idea. So I taught myself how to code. So I treat it like a full-time job. I spent, every waking moment teaching myself how to code, using loads of great online free resources. And eventually I managed to get a job at NHS Digital as a software developer on their graduate scheme. And that was where I became sort of really interested in the idea that you really need to create products for the user in mind. And I learned a lot at NHS Digital about really making sure that it's very clear, that there's lots of things you can do to make a product more accessible. And that's one of the primary things I've brought to Liria Digital, is the idea that you really need to have the person in mind before you create anything. It's the person first before the tech. And currently I'm still at NHS Digital and I work in their cybersecurity department. So I've transitioned again from software developer to cybersecurity. But my focus is not particularly the tech of cybersecurity, but the sort of psychology of why people do the things they do. Why do people click on the phishing link, and how do we create more training around preventing people from doing that? So that's my background.
Again, still very much focusing all about the people as well. I think that underlying theme there with yourself, Lianne, and I remember when we had our first conversation, it was yourself that introduced me to the term digital divide, and I was straight on Google looking at it, and it's just such an interesting area and really important one as well. So it's something that I'm still really kind of interested in as well. I think I've tagged you in things since, haven't I, about it and things like that. So fantastic, brilliant. And Erika, if you just want to kind of give a little bit of background to yourself as well.
So hi, I'm Erika. I literally also, like Lianne, I'm not from the tech sector. So obviously I spoke with you, Mel, in terms of my interest to get into the tech space. So I'm a pharmacist. I've been a pharmacist for over 15 years. I initially started in community pharmacy, and then I branched into hospital. I managed a really busy outpatient department in York. And it was almost there when I saw this gigantic robot, a dispensing robot. I thought that's an interesting contraction, and which actually really helped us manage our dispensing volumes. It's a very, very busy outpatient department. And as with tech, it's only good as the people that use it. So it used to break down quite a bit because we had to put into the machine part dispense products. And sometimes, because it was so busy, we just didn't have the time to do so. We also use a lot of kind of complex systems to try and manage prescriptions coming into the outpatients department. I also oversaw really kind of complex oncology prescriptions and so forth. And then I moved to Hull, and I'm now a locality pharmacist, so I'm in commissioning support. So it's completely different to how I initially trained. And there it's pretty much in terms of dealing with medicine optimization. We deal with a lot of more in terms of the data side. So I'm the locality pharmacist for the whole area. And we oversee first-time practices, trying to get them to prescribe more quality products and also to save the NHS money. So they then can actually plough money into creating better services for the population. Yep. And there it was quite interesting because we see in terms of the data, we see within Hull, there is a lot of health inequality. So within the more affluent parts, you see in terms of the prescribing is a bit more, much better than the kind of the not so affluent parts. And the data doesn't lie. I like to see the narrative behind the data, because obviously look at it, it doesn't mean anything. But when you actually can dig down and see where these practices are located. I think you've got a ghost in your room. It's my 3-year-old.
Oh, hello, what a welcome addition.
I don't welcome, don't to try to feed.
Listen, this is real life and this is what happens, right?
I'll give you a second, darling. Okay. I'm coming. I did kind of do a bit of a talk beforehand, but that seems to go in one income of the other.
I was kind of worrying it'd be my cat that would jump in on mine, but I've actually locked her outside, so there's no chance. So you were saying obviously quite a big divide among
in terms of the population. So one of the projects which I'm actually managing is campaign to reduce opiate prescribing. And originally from London, moving up north, there's actually clear north-south divide in terms of prescribing, and I always kind of laugh with my colleagues that, you know, that up north we tend to like our opiates. So it's actually unfortunately linked to socioeconomic status and a lot of mental health and so forth. So looking at the data in terms of looking at how we can really drill it down and analyze how we can help patients, that's one thing I'm really passionate about in terms of how tech can be used to, one, to transform care, better access to services, and most importantly, actually prevent disease, because actually disease is on the increase. And about 1.5 years ago, because actually with my dealings with tech and looking at the data and so forth, I really wanted to get into tech. So I've been having lots of conversations with people within the tech space, I've spoken to you. And the tech space is a lovely bunch of people. I've had so many conversations with people. And one of the events which I went to was the Empowering with Tech scheme. And after I left one of the events, he's trying to get into the conversation.
That's okay. Let him get involved.
Okay, take Mummy's phone. Take Mummy's phone. That should keep you off. It's in the kitchen.
Go play with some tech.
Exactly, yeah. Has some benefits.
Exactly.
So after I left one of the events, I left. Right, let me do the Face ID because I've just upgraded my phone and they can't get into it as easily now. I left one of the events really buzzing, thinking, wow, I really want to get into this space. So then I went online, as you do, and I enrolled in the mentorship scheme. And they did say that I was really kind of overprescribed, you know, be patient, because you just had every woman that she play in the background.
What's that theme song?
So once I literally kind of enrolled on there, and then about a couple of weeks I didn't hear anything, and so then I went onto Twitter and I messaged Natasha privately. I said, I really want to get into tech. Partner with a mentor, and then lo and behold, I partnered up with the lovely Liria, and that's how obviously we started Liria Digital Health. So yeah, that's a bit about me, my kind of convoluted story, and also with my 3-year-old coming in.
And I think, Erika, like the thing that really stands out about yourself for me is like your proactiveness and your perseverance, and this is something you're obviously really passionate about, and you've kind of, you know, you see the end goal and you're going to do what it takes to get there, and kind of it really sounds like you're making great inroads with that, which is amazing. So that's how you guys kind of met then, and obviously Liria Digital has kind of been born, and so it'd be really good to just kind of understand a bit more about, you know, what is your offering to the market, you know, what are you hoping, you know, what are your kind of hopes and dreams for the business, I guess.
Oh, is it me? Oh.
Lianne?
Yeah, you can.
Okay, so our vision literally is we see obviously a lot of health inequalities within, especially within femtech, and our passion really is to raise awareness. So our first product will be around featuring the menopause.
Right.
I'm sure you've heard of the book by Invisible Woman by Caroline Criado Perez. And she's obviously an inspiration. She's done so much within this space, and there's a lot of stats and data surrounding especially women. We started, I mean, obviously we're really in the initial stages of our startup, and we've been doing lots of youth focus groups around this area. And what's become apparent is that menopause is really under researched and almost the unloved area. And obviously we both have very, you know, personal stories surrounding this. Obviously both our mothers, well, my mother experienced it. So our vision is for Liria Digital is not just going to be centered around the menopause, but really to focus on the unloved, the under-researched areas within tech, and to really raise awareness, transform care, and also reduce the digital divide. So that's our main passion, to really, you know, for our vision for Liria. Yeah,
we want to give people who are using our service the freedom to live their lives as individuals, not as health conditions. You know, one of the sort of main drivers for us is the tech we're going to create. We don't want people to be tied to their phones. We want it to be a very offhand sort of experience. We don't want people to constantly get pinged notifications all the time. We don't want people to become either stressed out or addicted to our tech. We want people to live their lives first and foremost, and then the tech is a facilitator to help better health outcomes. So it's not the other way around, whereas, you know, so there's a lot of sort of tech out there that's designed to make you addicted to their service, so you're always on it. That's totally not what we're about. It's having what tech really should be about, which is it should just be helping you, not hindering you.
Yeah, solving the problem, definitely. And I know you mentioned obviously that this kind of flagship project is around the menopause, and it is, you know, you said yourself you both got personal stories as to why you've kind of gone down this route. I think, you know, I mentioned as well, like, I think probably every young woman, or if you've got a mum, an auntie, a grandma, you know, you have a story, you know someone who's really struggled with this. So how are you going to try and go about sort of offering a solution or support around that? What is that kind of solution or product going to look like? Are you kind of at that stage where you can kind of talk a little bit more about how you're going to help the people going through the menopause?
Yeah, well, one of the things we're doing lots and lots of focus groups, not just necessarily with perimenopause or menopausal women, but we're doing them with GPs, which is the sort of biggest sort of stumbling block. Is like the first thing whenever we hold a focus group with women, is the experience with GPs has always been quite poor. It's always one of those things where, you know, they'll go to the GP and the GP will say something like, well, you're a woman, it's just what you go through. And medically, you know, the menopause is always just considered a transition, and just something very natural, which it is, but it doesn't take into account that the symptoms, which are so wide ranging, can have really detrimental effects on people's health and well-being. And because of that, because it's just considered a transition, like puberty is, it just kind of gets dismissed in terms of, oh, well, you just need to go through it, stop bothering with me. And because a lot of GPs don't specialise in it, because there isn't time really to specialise in it, a lot of GPs don't feel comfortable discussing and prescribing in a way that's adequate, to be honest. If that's the correct word to use, in adequate way. So they can't take into account, and they miss sort of key signs of, you know, things that do go undiagnosed, you know, things like joint ache gets misdiagnosed as arthritis, so then you prescribe how you would for arthritis, and that can lead to a negative impact, because if you're being prescribed, you know, steroids instead of, you know, what you should be prescribing, estrogen instead, it can lead to bone thinning, and bone thinning obviously leads to more falls and broken bones and difficulty healing, which can impact the NHS. Or, for example, one of the symptoms is low mood. Now, if you go to the doctor initially with low mood, rather than menopause symptoms, they'll try and prescribe for, you know, depression, and then you'll get put on antidepressants, which isn't the solution, because it can be a very easy solution. You know, HRT therapy can solve quite a lot of these issues if that's the route you want to go down. So one of our sort of main efforts is the education piece. So we're working really hard to make sure that GPs see the benefit not only for their patients but also financially, because, you know, which is why mine and Erika's collaboration works so well, because of Erika's background with, you know, the idea that we are prescribing quite poorly in some areas, and that's costing the NHS thousands. If we prescribe better, not only will people actually feel better, but we're actually saving lots of money in the long term as well. So it's very much a dialogue. And one of these sort of crucial things that we're also looking at, and which comes up time and time again in our sort of focus groups, is the word sisterhood. Now, people just don't talk about the menopause. You know, it wasn't until my mum was going through it that, you know, I was quite proactive and said, tell me about what you're going through. But, you know, I don't talk, you know, but until this project, I've never talked about it with friends or anything like that. Nobody talks about it. You know, nobody in my age group talks about it. You know, my mum never spoke to her mum about it. And it's just a systemic thing that nobody talks about it. You have one talk with your GP and maybe one with your partner, then no one ever speaks of it again. And that lack of information is detrimental. Because when you fall into the menopause, totally a shock, you don't know what to expect. And therefore you don't know how to really deal with it and manage your symptoms adequately enough. And it just keeps perpetuating. And then if nobody's talking about it, then nobody's raising awareness. So it's a societal and a medical issue.
What do you think, Eric? Have you got anything to add on to that?
Regarding, I'm not sure if it was really well publicised that, you know, HRT, there's a huge shortage. And I also, even though I've left community sector, but once every 4 to 6 weeks, I do locum at my local pharmacy. So I do like the patient contact, and you have women coming in and just desperate, you know, ringing around for HRT because it's almost like a lifeline. But the problem is there are no alternatives being offered to these women. And it's just, it's a travesty, I think, in this day and age, that there isn't much awareness. It's almost, I hate using the word taboo, you know, menopause, everyone was going to go through it. And the strange thing is there's a myriad of symptoms when everyone will go through it. And I think once you're aware of what's on the horizon, that's half the battle. And some of these symptoms seem to sneak up on a lot of women. And I think it's that you're trying to figure out, you have to go through these batch of tests to figure out what's wrong with me. And that should never happen in this day and age. So, you know, adding to what Lianne was, that we really want to raise awareness and to really just change the narrative around the menopause. You know, as you know, we always like the headline, change is good. You know, it's an amazing Hello. He's actually using my phone to FaceTime people. I don't know who his FaceTime. You could really
like 10 people coming to your door now.
Yeah. So yeah, totally, you know, echo what Lianne is saying, that, you know, our passion is really to raise awareness and to change and transform perceptions around the menopause. Yeah.
It's amazing. I think, like you said, the big piece is around education, is it, as well, in that sort of sense. Amazing. Okay. So what's kind of like the hopes and dreams for Liria Digital? You know, where do you want to take this? What do you want to kind of be seen as to your market? I'm guessing sort of, you know, tech for good, doing good by the people that you're providing your products and solutions to. But I guess what's the dream for you ladies?
Yeah, well, what people have been asking for, you know, we've come and said, you know, this is what we're focusing on, this is what we want to do. You know, they're asking for empowerment over their health and bodies. You know, people are so much more engaged with their health. You know, everyone has, you know, the step tracker on the phone, people wear Fitbit watches. People are interested in tracking this. You know, people are active a lot more so than ever before, especially now with sort of COVID. The NHS app, for example, had over 1 million downloads.
Hello.
Whereas before COVID hit, I think they were getting something like 15 downloads a day. It was really, really low, because it wasn't much, but now we're at 1 million.
Which is because phenomenal, isn't it? That's just crazy numbers.
And that is because of COVID. You know, for as awful as COVID has been, it has raised a lot of awareness about, actually, I want to take more things into my own hands, technology-wise, and be able to engage and act in that way. And so what we sort of see with the menopause project directly is an ability to bridge that gap, as I was saying, with the sort of the clinician side of it. So if you're, you know, on HRT, for example, and if you have an alert and it says, oh, how are you finding it at the moment? And if you rate that maybe, you know, out of 5 or something, if it's anything below 3, do you want to arrange an appointment with a GP? Rather than leave it months and months before you see the GP next, do you want to actually engage and have a quick call? And then you can actually change your dosage and, you know, hopefully improve your outcomes that way. So that's how we see the menopause project itself. But our ambitions for Liria Digital overall is we want to be a company that people come to and say, I've got this health condition and I've got an idea for how tech could really help. It's really under researched, it's really underloved, this condition, but I know that this would really, really help people. And especially in times now, you know, you hear about the postcode lottery, you know, in some areas, you know, you can get this amazing drug to help you with this really niche symptom or disease, but then maybe the next postcode over, you can't get it. If there was a technological solution that would be able to help you manage things like that, then we want people to come to us and say, we've got this idea, can you help us get it off the ground? So that's our vision for Liria Digital. So our first product is the menopause, because it's something we feel really strongly about. But our overall ambition is to be the people, the tech innovators that people come to and say, we've got this really unique proposition for you. Nobody's looking into this. Because, you know, people are always interested in sort of the bigger conditions, you know, cancer and things like that, and diabetes. But what we, you know, it's always been the sort of forefront is, if no one's talking about it, that's a travesty. So that's what we sort of envision for Liria Digital.
Definitely, and behind that, there's obviously, you know, potentially tens of thousands, hundreds of thousands, millions of people behind that sort of thing that's not being talked about or not sort of looked into further. So amazing, fantastic. So how can people find out more about you guys then? So, you know, where you're at with your journey, it sounds like you're looking at potential collaborations maybe later down the line, like people to get involved with you, bring ideas to you. How, you know, what do you kind of need at this moment in time? Like, how can people support you? You know, is there anything that anyone maybe listening to this who's thinking, wow, this sounds amazing, I want to get involved, I want to reach out? Like, what support or help could you potentially have at this moment in time?
So we will be launching Liria Digital Health at the Leeds Digital Festival on the 2nd of October. So that'll be our first kind of call to action to come and see us launch Lyria. We actually have it's registered on the Eventbrite's webpage, so hopefully we can give you the link to share. That'd be great. We also want to look up for more personal stories. So we've been holding quite a lot of focus groups, and we've been able to extract a lot of user stories, personal stories, because we want to use many stories from women to shape how we're going to make this product. So that's key. And we're looking for personal stories from, you know, premenopausal, postmenopausal, and during the menopause. We want to try and get a whole range of women experiencing a myriad of symptoms. We're also looking for collaborators in all aspects. So user researchers, designers, software development. If you're looking to get your portfolio started, we'll be more than interested to kind of get you on your way. Because we are an exciting you know, startup, and we are a friendly bunch, as you can see. You know, we do like to spell, we're very passionate.
Family friendly.
Yeah, super friendly.
Very much
so.
So.
Do come and, you know, give us, you know, chat with us, and, you know, I think it'll be perfect. It's like a match made in heaven. And we're also online, so you can find us at www.liriadigital.com. We're also on LinkedIn and Twitter at Liria Digital. So do come and say hi, and you'll find us there.
Perfect. And we'll share all the links and sort of, you know, ways for people to get in touch with you and reach out and things like that. So fantastic. Well, yeah, I'm super excited to see where this goes, and you know, I can just imagine where it's going to go and kind of what you're going to do in terms of sort of pushing this forward. So it's very exciting. Tech for good, 100%. Like, what you're doing, you know, you're passionate, you know, you care. I think that's the main thing. Like, you really care about what you're doing, and you want to make a difference to people's lives. And I think, you know, from that success will come. So I'm really excited to see where it goes, guys. So the best of luck with Liria Digital, and, you know, best of luck with the launch as well at Women at the Leeds Digital Festival. Like, that's a great time to be launching it out there. So yeah, thanks for taking the time to have a chat with me, and I'm sure I'll meet you both in person very soon.
Yes.
Thank you for having us. It's been great.
Yeah, thanks. Thanks,
Leanne, thanks, Erika.
Thank you.
Catch you later.
See you.